Kris Urbauer, welcome to the program.
Nice to be here. Thank you.
Thank you for being on. We're going to talk about VA, and we're talking about, you and I have a very similar situation in life, and we're just going to brainstorm a little bit together to help classmates if this is even helpful. You use VA primarily. I actually just went in for one of my first appointments with VA. I plan on using VA to bridge me to 65 when there's more Medicare and things like that. Talk about your journey there and what your thinking was on VA.
Definitely. So I will gladly carry the flag for the VA because it's been a blessing for me. So those last 5 years or so of my career, I had healthcare from my job with the veteran service organization I worked for. I knew I wanted to retire at 60. I decided that I wanted to punt in January as opposed to waiting to my birthday in June. So initially, when I left Hiring Our Heroes, I took Cobra, which was expensive, but not as expensive as the stuff on the Obamacare platform thing, whatever the heck the proper name is for that. But so I was like, well, I'll hang on to this Cobra thing as long as I can. And then what do I do? So, I guess it was last summer, about a year ago, I heard about, the PACT Act, which I had never been familiar with. But it's really for us Gulf War era veterans who might have been exposed to burn pits and all that fun stuff. And you guys can obviously read about it on the website. But with my being at, in Ground Zero after 9/11, I thought that should qualify me. So, I did my intent to file last summer, and then I believe it was in March of 2024 where it was announced that they were moving up the calendar or whatever the timeline, so those of us that would fall under the PACT Act could apply for healthcare without a disability rating yet and hopefully be covered. So I did that as soon as I heard that, and within a month I was accepted and was enrolled in VA healthcare. And like I said, I was buying Cobra, and I was going to end up going to the marketplace if I needed to get me to 65. But it's been a blessing, and to be honest, I have had nothing but fabulous care since I started in April. I realize it's only September, but I've had a number of appointments, and everything has really been fantastic.
That's been my experience as well. So what not getting anything personal, but what types of appointments have you had? Have you had blood drawn? Have you had, what are some of the things that
I've had lab work, of course. I have horrible migraines, which I'm trying to blame on Ground Zero, but we're still working through that because I'm still working through the disability track a little bit. I did get a rating for my feet because I have bad feet. So I've had podiatry appointments. I've had a CAT scan of my neck tied to the migraine thing. I've seen the neurologist. And if you want to try to see a neurologist in the civilian world, it's almost impossible, or you're going to wait forever. So I was thrilled that I was able to get in and see this wonderful neurologist with the VA. And I've got another appointment already 6 months from now to, follow up and everything. So I've had, like I said, nothing but wonderful experiences. I've got my eyes checked. I've got my feet checked. Obviously, you went to the podiatrist, like I mentioned. I got some great insoles for my shoes. And then I've seen the neurologist. I still need to get a cardiologist because I have had a heart attack and I have to follow up on that. So that's been a little slow. I need to get them moving on that.
Get that going, sure.
Get that moving. But in general, nothing but,
So
but praise. And even
so this is, you're using VA like healthcare, like
I am using it for healthcare.
A program you would use on the exchange. And how does the money work in terms of you pay a little bit of a copay, or how does that work for you?
So just about everyone, unless you're in priority 1, and that's not me, will pay copays for prescriptions. But now that I do have a disability rating, even though it's only 10%, that takes away all other copays except for prescriptions, which is really nice. Once again.
So even if you have 0 disability, you have copays, but then if you get some disability for a variety of things, then you can the copays go away.
Up the priority
and the copays are much lower than a civilian program.
Yes, they are. And there's no monthly premium, which
and there's no monthly premium, and I can tell you this from experience. So I signed up the same time you did. I had on my DD-214 service in Iraq. was immediately made eligible, like no question, no means test,
That's awesome.
and off I went. So at the end of the year, the tax man, actually I have a tax lady, so the tax woman gets the 5566 or whatever, which is my proof of healthcare from the VA. Done, dusted, right? So none of the exchange, none of that stuff. So we all have choices. We can certainly pay on the exchange. We can get our high-end healthcare. We can pay a doctor directly. It's another way that some of us have had to do it in the past. Or the VA becomes one tool in your kit bag that you can use to have coverage, particularly in this age 60 to 65. Other thoughts on VA, Kris?
Like I said, I've just had nothing but good experiences as far as filing for disability. I did it myself. Everybody said you should get help. You should get help. I just thought, why am I going to go tell somebody else what I think is wrong with me and have them do it when I can just do it myself? I think it's very simple online. Uploading files. It takes some time, but it is what it is. I just have had really good experiences with both sides, with trying to file and then the healthcare side. So
Tremendous.
no
It's so
complaints
great to
there.
hear a story from someone who's gone through it. Thanks so much.
You're welcome.